Good morning, Marie. How are you feeling today?
Je suis un peu nerveuse, docteur. C'est mon premier frottis cervical, et je ne sais pas à quoi m'attendre.
That's completely understandable. A pap smear is a routine test, and it's an important part of your health checkup. It helps us monitor the health of your cervix by checking for any abnormal cell changes. If everything looks good, it's a reassuring sign that you're healthy.
Est-ce que ça va faire mal? J'ai entendu certaines femmes dire que c'est inconfortable.
You might feel a little discomfort, but it shouldn't hurt. I'll be very gentle. During the procedure, you'll feel some pressure when I insert the speculum and a cold sensation from the gel. I'll also use my fingers on the outside of your vagina to feel for any masses or abnormalities. I'll explain everything as we go along, so you know exactly what to expect.
D'accord, je suis prête. Que se passe-t-il en premier?
First, I'll have you lie back and place your feet in the stirrups. This will help me get a good view of your cervix. Then, I'm going to use a small device called a speculum to gently open your vagina, which will allow me to see the cervix clearly. You'll feel some coldness and pressure as I insert the speculum. After that, I'll apply some gel to make it more comfortable.
D'accord, je suis prête.
Great. Now, I'm inserting the speculum. You may feel a bit of pressure as I do this. You might also feel some coldness from the gel. It's completely normal, just let me know if anything feels uncomfortable.
D'accord, je sens la pression maintenant, mais ce n'est pas trop mauvais.
That's great to hear. We're almost done with this part. Now I'm going to use my two fingers on the outside of your vagina to feel for any abnormalities or masses, just to make sure everything is normal. You may feel a bit of pressure here too, but it should be brief.
Je sens la pression, mais ce n'est pas douloureux.
Perfect. We'll finish up soon. The pressure should be mild, and the discomfort should pass quickly. We're just making sure everything looks good and checking for any abnormalities. This part of the exam is routine, and it helps me feel for anything unusual. Almost done, Marie. You're doing great. Now I'm going to remove the speculum and wrap up the procedure. It'll only take a moment.
Ce n'est vraiment pas aussi mauvais que je pensais.
I'm glad to hear that. It's normal to feel a little nervous beforehand, but you handled it really well. Now I'll remove the speculum and finish up. All done, the test is complete. How are you feeling now?
Je vais bien, un peu soulagée. Ce n'était pas aussi mauvais que je l'imaginais.
I'm glad to hear that. It's important to stay on top of these regular exams, and you did the right thing by coming in today. Now, I need to talk to you about something. During the procedure, I noticed something unusual. There's a small area on your cervix that doesn't look quite right, so we'll need to do further testing to be sure.
Qu'est-ce que cela signifie, docteur? Est-ce grave?
It's understandable to be concerned. What I'm seeing isn't necessarily dangerous, but it's important that we follow up. The area I noticed might be a sign of early changes in the cervix, but we can't be sure just yet. I want to schedule a follow-up test called a colposcopy. This test uses a special magnifying device to take a closer look at your cervix, which will help us understand whether there's something to be concerned about. It's a simple procedure, and it will give us a clear view of what's going on.
Cela semble sérieux, mais je comprends. Que se passe-t-il pendant la colposcopie?
A colposcopy is very similar to the pap smear, but we use a magnifying tool to see the cervix in more detail. It's not painful, but you may feel some mild discomfort. During the procedure, we may also take a small tissue sample, called a biopsy, if necessary. It's important to follow up on these changes, but I want to reassure you that in most cases, it turns out to be nothing serious.
D'accord, docteur. Je vous remercie d'être clair avec moi. Quand pouvons-nous programmer la colposcopie?
We can schedule it today, and I recommend that you come in within the next week or so. The sooner we do it, the better, just to be sure. Don't worry, though. I'll be with you through the entire process, and we'll keep you informed every step of the way.
Merci, docteur. Je me sens un peu mieux maintenant que je sais à quoi m'attendre.
Of course, Marie. You're doing the right thing by taking care of your health, and I'll make sure we stay on top of everything. I'll have my nurse schedule the colposcopy for you. If you have any questions before the next appointment, don't hesitate to call. You're not alone in this.
Merci beaucoup, docteur. Je vais voir l'infirmière maintenant.
You're welcome. Take care, Marie. I'll see you soon.